All right, welcome. If you are here with me, you got to the inside. So welcome, you're on the inside. So everything, again, is designed for a reason. Why I gave you an outline is because I believe that people with anxiety love to know what's coming next. That, again, calms them. And I've had a lot of people say, I've spent years in therapy or counseling, and if I would have had an outline, if I would have known this is what we're going to talk about next, or this is what skill we're going to learn, I think I would have gotten a lot more out of it. And I agree. So this is not just like clinical therapy or counseling. It's also about life coaching, right? It's about skills. It's a kind of a workshop feel, but done on an individual basis, which I think is very much needed for anxiety. So you'll see that I have given you an outline, and I will meet with you once a week. If you're looking at this, that means you probably already set up that session. So let me tell you now, you can go over the outline when I open it up, but you don't have to, okay? It's not needed. I don't want you to think about, if I didn't open it up and watch the little video, if I didn't download the thing, then I'm gonna be in trouble. There's no in trouble, okay? I'm not your teacher. I am just partnering with you as your coach to help you maximize your time for the 90 days. So if you really like looking ahead, go ahead. If you don't want to, that's fine. We'll talk about it in session, and then I will refer to the outline because many of your downloads are going to be in there. And then there's also going to be things, of course, in your special black box. All right, so your first session is going to be about a clinical assessment. When I did a survey while I was in class myself, learning how to create a really good program, one of the things that I needed to do is to do a Google survey and say, what do people want? Like, you may know what you think that people want, but let's do a survey. The top two things on my Google survey concerning creating an anxiety program was, number one, people wanted to know what type of anxiety they had and what type of anxiety they didn't have. And number two, people were asking for realistic, practical, everyday little interventions and tips for their anxiety. All right, so both of those things have been included. Now, old school years ago, when I had my private practice, we would do assessments just verbally. This was the problem. Some of my counselors that were working for me would not even get it done in a full hour session. And I would say, why didn't you get that done, right? And they would say, well, then the person started talking about childhood, and then we were doing this and this, and then I would say, oh, but did you ask them about this? Did you ask them about this? And they're like, no, I forgot to do that, right? So what happens is people feel frustrated because it's like dragged out and they didn't even get the assessment done. And two, a lot of things get missed. So I have found it's much better to do an online assessment. It is non-biased. You go question by question and we just get it done. If there's anything that you're like, oh shoot, that question was kind of asked a second time, and now that I think about it, I kind of want to change my answer and I wish I wouldn't have said that. Maybe I didn't understand the question. It's okay. Don't worry about it, because when it's all done during the second session, we'll go over all of it together and really come up with your anxiety blueprint. So this is really good information. Not only is it going to talk about anxiety, but it's also going to look at possibly self-esteem, if your self-esteem has been damaged by it, and also if there is some depression in there, okay? So I am a clinical therapist, and so I am going to log on live, and then I will ask you the questions and I will type them in for you. And then later that company will do a printout of exactly what type of anxiety you have, you don't have, the recommendations after the assessment, this works for this, blah, 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 and we'll go over that together. So mainly the first session is just going to be the assessment, although I'm also going to talk to you about the importance of having a vision of what your life could look like at the end of the 90 days. What do you want? What do you desire? If you didn't have the hindrance of anxiety in your life, how would your life be different? And I'm going to talk to you about why that's so important to work on that this week. I also want to say that if you don't have time to open up the outline on the module before session, that is totally fine. Please don't feel like I can't come to the session because I didn't look at the video, I didn't look at the outline, I didn't download if there was a free download. Please don't feel that way in any way, okay? I'm here, I'm a laid back, calm person. I'm here to help you, and we're gonna do it together. All right, I can't wait to see you in your first session for your assessment. Let's do this.